So you have
Lahiri,
point N, point P,
our
O,
dental specialist, is today giving a lecture
and if you
on a
join
dental
them,
subject.
you will find some lines. If you put it on a tracing paper and you trace the whole of the skull and you join all the points, you will have some lines and some angles. So if you join the ANS with the PNS, posterior nasal spine and the anterior nasal spine, you have a line. If you join the gonium, the GO, on the left the angle of the mandible, and the Nathian on the chin, you have a line from GO to GN. So there are plenty of lines on the lateral skull, and there are plenty of angles also. You see, the angle B, the point NA and the point BA when joined, it has an angle with the point BC and PO. So there are points, there are lines, and there are angles. If you trace it on the skull X-ray, it will look like this. Okay. The BA is Bayesian, the AN is the angle is the spine, the point B is on the chin, the GN is the Nathian. Okay. There are plenty of points on the skull. If you go to the next slide and you compare the points on the soft tissue of the face, it's slightly different from the points on the hard tissue of the face. Okay. These are the points on the skull bone, and these are the points on the soft tissue of the face. So to read a face,
सेंटर वाला
to read a face, you need some points on the soft tissue of the face.
Center.
So this is subnasal, okay. This is Nathian, this is tropion, okay. This is the endocanthus, this is the exocanthus. You have a point here called labial superioris on the most external part of the upper lip. You have a point on the chin, see, absolutely just below the chin, most lowest part is called the mentum. So you have some points on the face. So these kinds of points on the hard tissue and on the soft tissue are called landmarks. So you need some landmarks to understand the face. So if you read the soft tissue of face and you go to the next slide, just see this. This is the structure of the skull of the same person at the age of 25 and the age of 65. So how much the face changes. So once this hard tissue changes, the soft tissue which is overlying the face, it will also change accordingly. So this is on the left is at the age 25 and this on the age is the age 65. It's both the same. Okay. Now if you see a face from the front and looking at exactly on the tip of the nose, the face can be arbitrarily marked into three parts. The upper anterior part, the middle anterior part, and the lower anterior part. So if the upper anterior part becomes more, the face shape will change. If the middle anterior part it becomes more or less, it will change. And if the mandible is placed slightly lower, the lower anterior part will change. So accordingly the face shape will change. So we have to measure the upper part, the middle part and the lower part. We come to the shapes. These are about 7 main facial shapes, starting from a square, a round, a triangular, and it goes to heart. And there are faces in between, like in between a square and a round, a squarish round or a roundish square. You have a face in between diamond and the heart. It's diamondish heart or heartish diamond. But the basic ones are of these 7 types: the square, the round, the triangle, the oblong, the oval, and diamond, and heart. If you put eyes and nose on this drawing, see what happens. It's oblong, it's rectangle, it's slightly round, it's square, and on the right is oval. Okay. So if someone has a face in between an inverted triangle and a heart, so it will be triangulish heart or a squarish inverted triangle. Okay. But if you you look at the basic face structures, it's a oblong, a rectangle, or a round. So if you look at it without the structures and look at it with the structure, see the difference. Okay.
এরকম ভাবে আমাদের স্কেচগুলো আঁকে মানে পুলিশের মানে ইয়েতে
এরকম ভাবে দেয়? So if we come back to this, the upper third, the middle third, the lower third. It's technically called the upper anterior third, this middle anterior third and the lower anterior third. Because the face we see from the third is from the front is the anterior part of the face. The face we see from the side is the posterior part of the face. Okay. So what we are seeing here is the anterior part of the face. So if we come from this, if you have appreciated this face, the parts, you see, this one is a long narrow face. Okay. So you have to find it out in the long narrow face, which part of the face has lengthened, whether the middle part has lengthened or the upper part has lengthened or the lower part has lengthened. If this is a fairly normal face, then according with relation to this is a long face. Okay. So what can happen in a long face when a patient comes to you? See, the palate will become narrower. The palate will have a high arch. So it's a high arch palate or a high warp palate and a narrow palate. So when the facial shape will change, so if you come back to this picture, you see this is the lower part of the face. So when the mandible goes deeper inside and the lower part of the face has a less height, so it will be a deep bite. Okay. If the lower part of the face is narrower, you find some dental crowding. See, this is called the crowding.
Crowding.
So one tooth has come up on the other one. So if the mandible shape is narrower, it will not accommodate the teeth in the right arch. Okay, it will become a crowding.
Actually, then the size of the teeth automatically don't reduce
No,
according to.
no.
Oh.
Understand? Because
No,
it's anatomically it's differentiated from different arches. So if you close the mouth, if you ask the patient to close the mouth and the patient cannot close it, so the bite will be open anteriorly. So it's called an anterior open mouth bite. So if you look, if you have a closer look, you see
Oh, wow.
the posterior teeth have already
Acha, acha.
in contact, the upper arch and the lower arch, but the anterior teeth have not contacted. So it can be a deep bite or it can be an anterior open bite. If you ask the patient to forcibly close it, or if the patient mimics someone, he gives you a wrong answer, long view, he will be unable to do it. See what happens in a line mark. It's a deep bite, see on the left. This part is shorter, okay. This is an open bite. So if this patient has an open bite and he wants to show you that he has a closed bite, he cannot do it. See the next picture. It's an open bite, okay. And in an open bite patient, the patient has forcibly tried to close the lips. So it will look like this. It will look as if he is trying to swallow. See the picture on the side. So it's quite difficult to mimic. Okay, in case of a open bite, the bite will always be open. If he wants to close it, it will look like this. See this face? It's an adenoid faces. It's a typical open mouth. The child breathes with the mouth. The breathing is through the mouth mainly. And she has a typical face of a adenoid faces. If you look at the next slide, see a person with a palliaus disease of the mandible and see what happens to the face. So if you have a close watch on the face, it will give you some answers. See the face, how the shape has changed. The shape has changed to a tall, it's broad, vertex is almost gone. And see from the side. As if this patient has tried like this, put some air into it, but since the palate is in the mandible. If you go to the next slide, see this child. And see this child after 1 year.
Oh my God.
And when you compare this,
Oh.
the same child after 1 year, the face has changed. It's the picture of a mouth breather who doesn't breathe with the nose. It's adenoid faces, and how it has changed in 1 year. So it's the same child after a year also. See this face on the left, and see this face on the right, and you compare. It has become tall. The lips are parted. It's incompetent lips.
How the two teeth have changed size shape?
No,
The
he has
upper
grown a
incisor
bit,
to
he has grown a bit.
Acha.
The anteriors have come, but see the shape of the face.
Yes.
This is broad here, this is narrow here. So if you have a close look, see this face. This is the face of a lady aged about 40 years who has bruxism. So she keeps on grinding her teeth. So have a look at the facial muscles and have a look at the broad face. So when this bruxism has been corrected, it has come back to the natural face.
Oh.
See the shape of the face. So face will tell you much about the patient. Have a look at this.
Yes.
Have a look at this. Have a look at the length of the face. Have a look at the length of the face. Look at the eyes. Look at the eyes here. This man, Farkas, he has died recently in